Hey everybody, I want to do a video commenting on one of my favorite YouTube channels of the moment, which is Cinema Therapy. Cinema Therapy is a channel where two people, a licensed professional therapist named Jonathan Decker and a professional filmmaker named Alan Seawright, sit together and watch movies and discuss and evaluate those movies, both from the standpoint of the therapy and psychological and mental health concepts that are discussed in the movies and addressed in the movies, and also from a filmmaking standpoint. And it's a very interesting confluence of two topics that I'm very passionate about and very interested in. I like their stuff. For the most part, they do good content, and I will continue to watch it going forward, but they have done two videos recently that are dangerously irresponsible. And I don't say that lightly, dangerously irresponsible to the mental health community on the whole. And I want to make this video addressing them both. So, addressing both of the show creators, not the videos. Anyway, gentlemen, Messrs. Decker and Seawright, you recently did two videos. One of them was on the movie Split. One of them was on the series Moon Knight. In both cases, you were talking about DID, Dissociative Identity Disorder. I do not have DID, however, I am a mental health patient. I have autism, high-functioning autism, what would have previously been known as Asperger's syndrome. And it is something that I deal with, and it's something that I comment on a great deal on my channel. For a very long time, I was embarrassed by it and ashamed of it. And then I decided to start speaking about it more openly and own it by talking about it and hopefully becoming a voice of insight on the topic. Now, that said, one of the things I have a problem with in the autism community, and I'm going to bring this around to DID in a moment, bear with me. One of the problems I have with the autism community is the people who try to say that autism is not just is not a problem, it's not a difficulty, it's not a handicap, it's just a different way of looking at the world. You just see things in a different way. It's not a problem. It's not a problem to be fixed. It's not a problem to be fixed. It's everyone else not understanding special little sunflower you. All of that crap is insulting, it's condescending, and it's inaccurate. You know, don't get me wrong, I am no fan of Autism Speaks. They are known to be an ethically bereft organization. I don't endorse them. However, one piece of criticism they get that they don't deserve is the way where they is the fact that they portray autism as a problem to be solved. They've been criticized for having advertisements and promotional materials where they talk about autism as a problem that can potentially terminate marriages, that can potentially alienate parents from their children, that can cause all of these problems. And they're criticized for saying that when that is very simply the reality of what autism is, or simply the reality of the effects that autism has. And it is not just a different way of looking at the world. It is me sitting on the sidelines watching the rest of the world play a game that makes no sense to me. That is not just a special different way of looking at the world. That's me being left out of life because I can't function in the world at large. It is a problem that needs to be solved. And I get the most condescending things, people saying, oh, but I bet you wouldn't want to I bet if you had the opportunity to be cured of autism, you wouldn't take it because then you wouldn't be you anymore. That kind of thing. And that is where I start to really have a problem. And I tell people, look, if you think autism isn't a problem and it's just a different way of looking at the world and it's all peachy groovy, hunky dory, let me ask you this. Do you want a child with autism? Are you hoping that you'll have a child with autism one day? Are you hoping that you'll get the opportunity to date or make love to or marry a person with autism? Is that something you're actively hoping for? I don't think so. And so, anyway, and it's kind of like there's this whole thing in the autistic community where they say you're supposed to say autistic person and not person with autism because you're supposed to acknowledge the identity first. Autism is not my identity. Autism is a medical condition I deal with. And I say person with autism because just like you don't say autistic person just like you would never say cancerous person. Anyway, now to be clear, I'm also not a politically correct person at all, so I don't actually care which one you use, person with or autistic person or whatever. I don't actually care, but as long as we're making a value judgment about the statements, that's my opinion. Anyway, so as I've watched this unfold for years where people have stopped trying to help autistic persons. Damn it. They've stopped trying to help persons with autism, and they've started instead trying to re-educate the whole of society and get the whole of society to change, to make the change. As I've seen that happen, I've watched what's happened in how transgenderism has been addressed. And, I'm old enough to remember that up until about 5 years ago, a transgender person was a person with a mental health condition which caused them to believe that they were the opposite gender of the one they were born with. And that the best, as far as we knew, the best way to help that person feel a reduction in the distress that they were feeling over the mismatch between mind and body, or I should say between thoughts and body, because your mind is part of your body. The best way to help a person deal with that disconnect was to help them cosmetically transition to appear to be the other gender and integrate into society in that way. Now what has happened is we are told that gender is this irreducibly complex concept that in which a person's belief system fundamentally overrides the agreed upon objective state of reality, and that it's the rest of us who don't know, the rest of us who cannot appreciate this heightened state of reality and this new understanding and this new awareness of gender. We're apparently the ones that really have a problem. And so you start to see the dominoes start to fall. And gentlemen, with your concept of dissociative identity disorder and the way you're talking about it, you are not, I don't believe either one of you is speaking from a position of genuinely wanting to help people with DID, although, or at least I should say speaking from a position of understanding how, or truly desiring how to help people who have DID. I think you're speaking from a position of political correctness and not hurting people's feelings. And that is why I was aghast the first time I watched those two videos. I watched those two videos 3 times to make sure that I was getting everything you said right. And gentlemen, what you said is absolutely abhorrent, absolutely heinous. You said that a person with dissociative identity disorder ought to be referred to as a system, not as a person, but as a system. That all of their identities ought to be treated as legitimate states, legitimate realities, legitimate states of being. That a so-called system ought to be referred to with they, them pronouns. and that if the person or if the system in question is not unhappy the way they are, then they should not be encouraged to get treatment. Rather, they should simply be accepted as a system rather than an individual person. Gentlemen, that is heinously wrong. That is ethically bereft, heinously wrong, absolutely disgusting. We cannot allow mental health care to devolve in this way, where one condition after another gets tied into political correctness, and as a result is redefined not as a mental health disorder for which the person needs help and treatment, but rather as a perfectly reasonable and perfectly acceptable state of being that the rest of us are too ignorant to appreciate. Now, I want to be very clear about something. In none of what I've described, in no way, shape, or form am I advocating for the harassment or bullying or mistreatment of anybody. I don't understand why the nanosecond you disagree with a politically correct concept, people immediately assume that you're a neo-Nazi that's calling for people to be put in ovens or something like that. But no, I absolutely do not support the harassment or bullying or mistreatment of any of these people. Yes, they deserve compassion, but they deserve compassion, but indulging their delusions as a legitimate state of reality is not an acceptable manifestation of that compassion. What you are doing is buying into delusion. You are encouraging people to remain delusional because you are afraid of hurting their feelings up front, hurting their feelings in the short term. You know, got to break eggs to make an omelet, as they say. At some point, if you care about these people getting help and improving their mental health, then at some point you have to be willing to say, this is not okay. This is the problem, for example, with the so-called body positivity movement, that where people, primarily women who are morbidly obese, or on the other hand, women who are morbidly anorexic, are put in a position of believing that these are two totally acceptable states of being, and you as the third party have to applaud them for living this way, have to be proud of them for living this way. You know full well that encouraging people to live in either of those two extremes is encouraging them to put their physical health in mortal danger. So, if you think that it's acceptable to treat a person with DID as a quote-unquote system that is a they-them and has multiple different identities living within one body, if you think it is acceptable to treat someone that, or to indulge someone in that, let me ask you this. What if one of those identities commits a crime? How do you punish that one identity without punishing the others that did nothing wrong? What about casting a ballot in voting? What about that? Do all 10 or however many personalities there are, do all of them get to vote? No, I think not. Because you are not dealing with a system. You are not dealing with a group of people sharing a body. You are dealing with one person who, in their delusion and in their mental illness, has convinced themselves that other identities exist inside them. And yes, I understand what you said, that these other identities usually manifest as a defense mechanism to protect the primary person. That does not mean that that does not mean that the other identities are legitimate, or that the person ought to be treated as if they don't, as if there's nothing wrong with them. No, there is objectively something wrong with them. You like to talk about movies. I've had to really stop and think, and I want the two of you to consider this. This is pertinent to the discussion I'm bringing up here. You know, you like to talk about movies, and I love the Matrix movies, except for the most recent one. I loved all of them. I loved the Animatrix movie. In fact, my regular viewers, I'm thinking about doing a top 20 favorite animated movies, and the Animatrix will absolutely be on it. Love the Matrix, love the Animatrix, all of that. But now that we know what we know now, that the Matrix was ultimately conceived of as a giant metaphor for the psychology, or not on the whole, but structurally set up as a giant metaphor for the psychology of transgenderism, we start to see the toxic effect that movie, and that way, not just that movie, but that way of thinking have had. That idea that what you think somehow trumps objective reality. Look at those movies. Look at the most recent Matrix movie, and look at Moon Knight, which you all reviewed on your channel. In both of these, you have characters who are therapists, psychologists, psychoanalysts, what have you, but therapists, mental health care professionals, who are set up as villains within the story. Villains because they are not villains because they are trying to stop the protagonist from seeing reality. And it's a very simple metaphor, knowing what we know now about the Matrix being a metaphor for transgender identity and gender transition. It's very simple to see that the Smith character that's posing as a therapist in the most recent Matrix movie as being a very obvious analog for the idea that any therapist that challenges your personal beliefs is not actually someone that's concerned with your well-being, but rather somebody that is personally opposed to you becoming the wonderful, beautiful butterfly creature that you really are. The same thing is obviously true in Moonlight, where the therapist is similarly set up as the villain that's trying to keep the hero down by way of psychoanalysis. This is the kind of bullshit that Scientology was pushing decades ago, and now it's being touted in, oh shit, yeah, in the movies coming out of the same town that's overrun with Scientology. Of course it's obvious, but anyway. It's now the same, this is now the same idea being pushed in a mainstream way. And this mainstream idea that anyone that's trying to provide you with mental health care, that you who are being accused of being delusional, is the very person who is actually seeing reality, and the person that's trying to help you is somebody that's actively trying to suppress you and antagonize you. It's not even that we're on a slippery slope. We've already gone down the slippery slope. I already provided 3 examples, and the most recent of which is this nonsense that you are pushing. This idea that mentally ill people, that if a community of mentally ill people gain enough social clout, then we are expected to indulge their demand that they are no longer fundamentally suffering a delusion or having a mental health disorder. We're just supposed to accept that it's something different, or it's a different mode of being, a totally valid but different mode of being. And that's the thing. What's the difference between indulging pardon me. What's the difference between indulging someone who has 10 different identities, one of which is Napoleon, and someone who just thinks they're Napoleon? What is the difference? that Napoleon is part of a system rather than a single delusion. This is not okay. We cannot, understand, we cannot force somebody. We cannot force somebody to seek out mental health care. I don't believe in involuntary commitment for nonviolent persons, but we cannot force people into mental health care. But that does not mean that we have to indulge their nonsense as a perfectly valid mode of being. Where does it stop? Where do you draw the final line to finally say this is totally unacceptable? We're not going to budge on this, even if it hurts your feelings in the short term. Where do you draw, and where and how do you draw that line? You didn't draw it with autism. You didn't draw it with trans. You didn't draw it with body positivity. You didn't draw it with dissociative identity disorder. Where do we draw the line? My God, the very idea that you are the idea that you, Jonathan Decker, as a professional therapist, are considering yourself beholden to the quote-unquote dissociative identity community, which is not a community of people that are trying to support each other as they get help, but rather a community of people that really and truly think that they are multiple identities and that they want to live that way and expect you to treat their other identities as real and legitimate functioning people. You are simply indulging their bullshit, and the fact that there's a lot of them doesn't mean that they're right. A lot of them, the DID community, probably the only community where the head count is done with multiplication. But anyway, if you want to see a real series, that delves into DID that is not just superhero bullshit, if you want to see a real series that delves into it, and yes, like you say, with anything, there's going to be a certain amount of dramatic license, but a series that really gets into DID, look at the United States of Tara. I know you prefer movies to you prefer movies to TV series, but will indulge certain limited series and that kind of thing. Well, United States of Tara went off the air and it's not coming back, so there's only 2 seasons. But that's going to give you that is what's going to give you the best possible portrayal of DID, not a superhero with DID. And here's the thing. United States of Tara looks at the effects of DID on the person around you, on the people around you. And, maybe, just maybe, you might want to consider getting help for your mental health problems so that you are not terrifying your children, so that you are not embarrassing and frustrating your husband or your spouse. Maybe you should actually get help so that you don't end up abandoning and hurting your loved ones like that fucking asshole snowplow driver we heard about a few years ago, who abandoned his family to go live with his quote-unquote adopted family because in his middle 50s he decided that he was actually a 6-year-old girl. That person is not a 6-year-old girl. That is a delusional person. And what's funny is the one place where we will slam down, where we will put the boot down, where we will draw the line in the sand, the one time there's one time in modern popular culture history that we finally drew a line in the sand and decided this is not okay, we're not indulging this. And that was when Rachel Dolezal decided that she was black. When word got out that Rachel Dolezal was masquerading, it was a white woman masquerading as a black person, a newscaster went to her and said, "These are your parents. Are these your parents? Are your parents white? Are both your parents white? Do you have any black ancestry?" And she says, "I don't understand the question." And we established objectively that Rachel Dolezal is not a black person. Rachel Dolezal is a delusional person who believed that she was black, and who, to this very day, she's done interviews in more recent times, to this very day, she lacks the ability to acknowledge and admit that she is not, in fact, actually a black person. She lacks the ability to do that. She will still, to this day, dodge it left and right. Why? Because she's delusional. And she needs help. And she needs sympathy. I'm not making a value judgment on her. I am saying that she needs help and she needs sympathy and support. But finally, when a person's mental health issues ran afoul of the politically correct consensus of our modern age, finally, then at that point were we willing to lay down, put down a line in the sand and say, no, here are the objective requirements for a person to be African American. You have none of those requirements. We are not going to indulge your personal feelings over the objective nature of reality. And that's the thing. That is the thing that you're ignoring. Identity, gentlemen, is a mutually agreed upon acknowledgement of an objective state of being. If I say this is a glass and you say this is not a glass, and you truly and completely cannot understand that this is not a glass, you are the one with a problem, not me. And yeah, it might hurt your feelings to learn that you're delusional, but you are delusional. And not hurting your feelings in the moment is infinitely less important than getting you the help you need in reality. Think about it this way. I am a guitarist. Now, if I say that I am a guitarist, that implies a certain level of musical capacity on the guitar. Now, there are degrees within that. I can be a beginning guitarist, I can be an intermediate, advanced guitarist, but if I am someone who has never held a guitar, never played a guitar, knows nothing about how to play the guitar, has no technical capacity on the guitar whatsoever, and I don't mean someone who has lost that capacity like a guitarist like Jason Becker. I'm talking about someone who never had that capacity at any point whatsoever to begin with, then I'm not a guitarist. If I say I'm a guitarist, there's an objective understanding, a mutually agreed upon objective understanding of what that concept means. It implies that the person has some degree of capacity on the guitar. So a person who thinks that they are an amazing guitarist, even though they've never touched a guitar and know nothing about it, that person is delusional and they need help. And what I find so deeply disturbing is the idea that you think that if the person in and of themselves is happy, then they don't need help. And Alan Seawright directly says that in the Split episode. Both of you have confirmed that you think that if the person themselves is happy in their delusions, then that's as far as it goes and they don't need help. As if the person with the delusions exists isolated from any larger effects that their delusions could have on the world. Again, as I said, as if they think that your family is not going to be horribly upset and damaged by this. And yeah, I'm sure there's some news report you saw about some family where one of the parents is completely bonkers and the children and the other spouse completely accept it and it's wonderful and happy and great. But that does not trump the larger reality of people having mental health conditions, and those mental health conditions pulling families apart and hurting loved ones and hurting friends and relationships and work, and people not being able to work, losing their jobs because of their mental health issues, people ending up on the streets because of their mental health problems, because of the effects that their mental health issues have on other people. I was in Midtown Atlanta a couple months ago, filling up my gas tank, and it was late night, and as I was standing there filling up my gas tank, there was a man in the gas station lot talking to no one, screaming at an invisible person, having a one-sided conversation with a person that was not there. And it was disturbing and heartbreaking to watch. And I thought to myself, you know what? It's only going to be a matter of time before someone out there is saying that we ought to respect that he really is talking to he really does think that he's talking to an invisible person, and that if he thinks he's talking to an invisible person, we ought to acknowledge that he is, or we ought to respect that he feels that way and not interfere with that. And then it'll only be a matter of time before we who do not see an invisible person being screamed at are expected to indulge in re-education, as we learn that most of the time the people we talk to are visible, but sometimes the people we talk to are invisible. And if we see a person talking to an invisible person, we need to respect that they really are talking to an invisible person because they identify as someone that can talk to an invisible person. Well, gentlemen, you have brought us to that point, and that is absolutely asinine. And I want to close. I'm more belligerent and more argumentative in this video than I prefer to be, but honestly, it needs to be said, and it's a point that needs to be gotten across. And I want to leave you with this. I know a man, have distanced myself from him for all of the kinds of reasons that I just described earlier, in terms of how people with untreated mental health issues affect other people around them. But I know a man who has been obsessed with the same woman for 20 years. For the first 5 years that he knew her, she completely rebuffed his advances and wanted nothing to do with him. Then he happened to catch her on a good day, and they had a pleasant conversation. There were 2 more days where they had pleasant conversations that were both positive, and he really and truly believed that he was bringing that woman into his life, that because of these 3 positive interactions, they were en route to being married, they were en route to spending the rest of their lives together. And then, because they had 3 good conversations out in public, randomly ran into one another and had 3 pleasant exchanges, he thought he knew her well enough to go into her home without asking, a place he had never been and never been invited to. He could not understand why she called the police on him. She told him she and members of her family told him to stay away from her, and told him not to have anything to do with her. And he interpreted that as needing to stay physically removed from her, but not approach her, but still be able to communicate with her. So, in 1 year's time span, in the time span of 1 year, he sent her 200 letters. That works out to about 1 letter every 3 days. And when she took those letters down to the police station to try to get a restraining order against him, one of his friends who worked at the police station noticed that some of the letters were open. He told this man that some of the letters were open and had been opened and read. And this man, the person in question, he interpreted that as a sign, as a sure sign that even though she was doing something, this thing to harm him, to get this restraining order, which he saw as totally irrational and totally an act of malice on her part, that nevertheless she was reading the letters and that this was a sign that she was still interested in him and she still cared about him and she was still romantically interested in him. Time passed, and I don't want to go too much into detail, but as you would expect, he inevitably was put in jail for violating the restraining orders, stayed in jail for a period of months, was eventually released on a probationary program, and continued to believe that this woman is still romantically interested in him, and continues to believe that he's receiving signs from God that this woman is romantically interested in him. The signs he received were that he was there were times this woman lives in his local community, and there were times when he was talking to friends and neighbors about his great love for her, and he saw her walk by at a distance. And he interpreted those 3 occasions when that happened to be signs from God that this is what God wanted for him. To this day, now 15 years after that time when he had those 3 positive encounters with this woman, 15 years later, I again kind of distanced myself from him, cut him out of my life. Checked in on him. I checked in on him earlier this year, and he still believes, 15 years later, he still believes that woman is thinking about those 3 days that they had together that were good, that were positive. He's thinking about those, he believes that she's thinking about those days, remembering how good it was, and that she's eventually going to come back to him after God convinces her that it's a good idea, that it's the right thing to do. He believes that she will come back to him and apologize for everything that she did to him, that the restraining orders, the stint in jail, the probationary program, all of that, all those things were all of those things are all malicious acts that she did against him, and she will come apologize for them, at which point he will tell her that he forgives her and he loves her anyway, and they will enjoy the remainder of their life in wedded bliss. 20 years he has been working this complete nonsense delusion. Now, I am not a therapist, but I submit to you, Mr. Decker, I am not a therapist, but I think it's very obvious that guy is having symptoms of erotomania. I mean, think about it. Symptoms of erotomania. Believing that a romantic relationship is possible even when the person in question has told them they're not interested. Believing that they have a romantic relationship that allows them to, with a person that allows them to transgress against that person's boundaries. Believing that they have a greater level of intimacy than they could ever possibly actually have. Believing that supernatural events are occurring to bring them together, and believing that there's a possibility for a romantic relationship even after legal action has been taken against them. These are symptoms, the primary symptoms of erotomania. You tell me, this guy has been apparently to hear him tell it, ever since he was put in jail, he's maintained a distance and kept out of any kind of contact with the woman. So at least that's good. But this guy, in his delusions, has terrorized and harassed this woman, all the while believing that he is doing something morally righteous, that he's doing right by her, that he loves her and she loves him, but she just can't see it yet. all of that stuff. This guy is obviously completely delusional. Do you think that it's okay that if he's happy, he'll tell you he's happy this way. He'll tell you that he doesn't want help, he doesn't need help, he knows she's coming back, and no one can tell him differently, and that the knowledge that she's coming back is what keeps him going and makes him happy in life and gives him a purpose. So you tell me, he's happy, says he's happy in the moment, and yes, obviously this delusion, like any system of delusion, has evolved to help him cope with tremendous difficulties and tremendous sociological difficulties, tremendous psychiatric difficulties, and that sort of thing. Yes, it didn't come out of nowhere, but that doesn't mean that it's healthy for him. That doesn't mean that his actions have not had drastic and horrifying consequences for the people around him. One person, and I'll get close with one more person, a person that I talked about a while ago on my channel, was a young man. I say young man, he was a man in his early 20s, who was suffering from autism to a much greater degree than I was. And I don't want to go into how he or any of these people have come into my life because I don't want to say anything that could potentially identify them or anything like that. This is a guy who came into my life a few years ago that I had to respectfully insist get out of my life, and I got him out of my life by way of his parents, who were still responsible for his behavior. But a man who in his early to mid 20s, his parents had basically, he was very low functioning autistic, and his parents had basically given up on getting him any kind of help, and they were basically just rubber stamping whatever he wanted, whatever ridiculous nonsense delusion, they were rubber stamping it. And what I'm talking about is he was into all kinds of aberrant sexual practices, and what we would call, if they were participated in reasonably and responsibly, we would just refer to as kinks and kink communities and all that. But he was a part of these things, and one of the things that they were doing, they were indulging with him, or they were allowing him to indulge in, was these age play communities, people who were sexually gratified by presenting themselves as children and that sort of thing. But he also had the mind of a child. He had the mind of a child and the sex drive of an adult, and he had a proclivity to hang around with children. And I eventually wanted him as the more I learned about him, I was like, nope, I want this person as far away from my life as possible. No amount of me being a good Samaritan is worth me having to put up with this absolute nonsense. So you tell me, Messrs. Decker and Seawright, you tell me, is that just a happy, differently functioning, differently abled person who, if they're happy the way they are, we ought not to insist they get any kind of mental health therapy, mental health treatment? Is that it? The guy, the low functioning autistic who is showing all of the signs of all of the signature signs of being a sexual predator and a pedophile, and who is completely incapable of shutting off his child-oriented sexual proclivities out in the world, even when he's surrounded by children himself? Is that something that ought to just be indulged in, that ought to just be treated as another way of existing? Where do you draw the line, sirs? That is what I'm insisting on with you. And to that last guy, the first guy I mentioned, never been able to get him any kind of, never been able to convince him to pursue any kind of therapy or mental health care or anything like that. But the second guy I mentioned, believe it or not, getting him out of my life involved referring his parents to a program that was hopefully able to get him some care and get him some guidance and some help that he needed. checked in on him recently too, just looking at his social media presence, and a lot of the really disturbing and problematic things he had been posting on social media were all gone, completely scrubbed clean from social media. And so that was good to see. I don't want to have him back in my life, but it gave me hope that maybe he's gotten some help. Anyway, those are two examples that I have. And I ask you, sirs, where do you draw the line?